Good morning. I'm going to read the nervous system, part 1. Sensory loss. The central nervous system controls the sensory and motor function of the body. Disease of the symptoms, therefore, lead the loss of some of these function, hearing, sight, sensation or feeling, and balance, loss, deafness, blindness, numbness or anesthesia, unsteadiness or ataxia. Other symptoms: buzzing or ringing in the ear, that means tinnitus, double vision or diplopia, blurring, loss of visual acuity, tingling or pins and needles, and dizziness. Motor loss. Motor loss symptoms and signs include weakness, loss of power, paralysis, complete loss of power, tremor, involuntary rhythmic movement, especially of the hands, abnormal gait, unusual manner of walking. Speech may also be affected, for example, with hoarseness, a rogue deep voice as in vocal cord paralysis. Slurred speech means poor articulation as in cerebral disease. Loss of consciousness. Patient may describe sudden loss of consciousness in a number of ways. I passed out. I had a blackout. I fainted. I had a fit. I had a seizure. I had a convulsion. Fit, seizure, and convulsion are all used to refer to violent involuntary movement, as in epilepsy. Doctors may say, when did you lose consciousness? Here is a passage from a textbook on the cause of lost consciousness. The principal differential diagnosis is between an epileptic fit and syncopal attack or fainting. Syncope is a sudden loss of consciousness due to temporary failure of the cerebral circulation. Syncope is distinguished from a seizure principally by the circumstances in which the event occurred. For example, syncope usually occurs whilst standing, under situation of severe stress, or in association with an arrhythmia. Sometimes a convulsion and urinary incontinence, loss of control of the bladder, occur even in a syncopal attack. Those neither of these specific for an epileptic attack. The key is to establish the presence of absence or prodromal symptoms or symptoms that occur immediately before the attack. Thank you. Now I'm going to read the exercise. Complete the table with words from A, B, and C opposite. Adjective: blind, conscious, deaf, dizzy, numb, light-headed, unsteady. Noun: blindness, consciousness, deafness, dizziness, numbness, lightheadedness, unsteadiness. Make word combinations using a word from each box. Double vision, epileptic fit, syncopal attack, urinary incontinence, prodromal symptom, visual acuity. A doctor is trying to determine the cause of loss of consciousness in a 52-year-old man. Complete the doctor question. Did you lose consciousness suddenly or gradually? Did you get a warning of the attack? What were you doing before you passed out? Were you worried or under any stress at the time? Did you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? Did your wife notice any jerk movement while you were unconscious? Thank you. Ahora voy a estar leyendo los ejercicios en español. Completa la tabla. Mira A, B y C para ayudarte. Adjetivo: ciego, consciente, sordo, mareado, entumecido, aturdido o con sensación de desmayo e inestable. Sustantivo: ceguera, conciencia, sordera, mareo, entumecimiento, aturdimiento e inestabilidad. Forma combinaciones de palabras utilizando cada palabra del cuadro. Visión doble, ataque epiléptico, ataque sincopal, incontinencia urinaria, síntoma prodrómico, agudeza visual. Y completa el cuestionario. ¿Perdió la conciencia repentina o gradualmente? ¿Tuvo alguna advertencia del ataque? ¿Qué estaba haciendo justo antes de desmayarse? ¿Estaba ansioso o bajo estrés en ese momento? ¿Se sintió mareado o con aturdimiento antes del ataque? ¿Perdió el control de su vejiga? ¿Su esposa notó algún movimiento brusco mientras estaba inconsciente? Es todo, gracias.